Good morning everybody, welcome to one of the videos on infection control. Infection control is really important when we're looking after our service users. Failure to follow infection control can lead to issues in related infections towards the client and the carers. It's really important we follow this training. PBL care do have a uniform policy which states bare below the elbows. Care staff going into care shifts should not be wearing wristwatches. If any member of staff have long hair, this must be tied up above the shoulders. Any staff wearing long earrings is prone to infection, so these need to be studded earrings. Please make sure you do not carry gloves in your pockets. That is poor infection control. It's really important that you wash your hands with soap and water or another form of hand washing, maybe alcohol-free gel. Once you've done that stage, we proceed to putting on your PPE. There is a specific way of putting this on in accordance with the NHS guidelines and the Department of Health. The first thing that should go on is your apron. The next thing that should go on is your mask. And the last thing that goes on are your gloves. This is the order that you need to follow from the policy. This information is also given to you on your refresher training. So, to put on your PPE, for aprons, gloves and masks, make sure you do your hand washing, as I've already mentioned in the video. Get your apron, make sure it's tied around the back. You will put your mask on. Once you've applied your PPE, the last thing to be applied are your gloves. Gloves are really important when carrying out personal care. This will stop prevention of infection control between you and the patient. So when you're removing your PPE, this is called donning off. So the first procedure we need to do is to take off your apron. The way we take our apron off is by breaking the top tab and bringing it down like so. Then we go to the back. We go to the back, then we roll it. Again, remove your mask. The last thing to come off is your gloves. The way you take your gloves off, bringing your finger down, pull, and then do the same again. And that goes into a little white bag you would have for your clients. One of the things we should not be doing is something called double gloving, which I've seen in the past. This is not an acceptable procedure in relation to infection control. If your task involves wearing glasses or goggles as part of PPE, please refer to the Department of Health guidelines, as this will give you more detailed on how to remove your PPE. Thank you for watching the video. By watching this video, you should have more understanding of the procedures you need to follow within PPE guidelines.